guilty. If convicted, he faces life in prison.
This is a Fox News alert. 3 members of a North Carolina-based missionary group helping Ebola victims in West Africa are now back in the United States. They arrived in Charlotte late last night. They, along with the rest of their group, will arrive later today and will all be immediately placed in quarantine for 3 weeks as a precaution. So far, though, none of them have any symptoms of Ebola. One of the 3 who arrived last night is the husband of Nancy Wright-Bull. She, along with Dr. Kent Brantley, both contracted Ebola and are now said to be improving at an Atlanta hospital, receiving an experimental serum in Africa. And, of course, there is no known cause or proven cause and treatment for the Ebola virus. Joining us now is Dr. Amy Edwards, an infectious disease specialist for the University Hospitals in Cleveland. And thanks for joining us. I want to start with this. There's a difference between the treatment that these folks who are coming back now and are being placed in quarantine and the isolation with the people who have Ebola. What is the difference between those?
Well, the patients who are in the hospital actually have Ebola hemorrhagic virus, and so they are in isolation because they are actively infectious, and we know that they are. However, my understanding is the people who are coming back from Liberia today or in the coming days have simply had contact with somebody who has Ebola hemorrhagic fever. So the concern is that they may start to exhibit symptoms sometime in the next couple of weeks, and so you keep them in quarantine for the protection of the people around them.
So that means they can't see their loved ones, or they can only talk to them on the phone, or how does this work?
Well, it varies based on which virus you're putting somebody under quarantine for. We did some quarantining back during the SARS outbreak in 2005. Ebola is a little bit different because it can only be spread by very close contact, for instance, with body fluids like saliva or urine or something like this. So my understanding of the quarantine that they're going to be doing is they're actually going to keep them on the grounds of the organization that they work for. As far as whether they'll be allowed to have contact, I assume they should be allowed to have contact. You just want to avoid very close contact, particularly of body fluids.
So would it be fair to say that by bringing these folks back here, obviously you're getting them out of harm's way, a terrible condition going on in Liberia right now. In some ways, not only are you kind of protecting them from what's going on in Liberia, it doesn't seem as though, from what you're describing, is presenting any kind of real health danger to those here in the United States. I was reading actually that they're screened in Liberia for possibly having any kind of symptoms, and then also once they arrive here.
Right, and they pose absolutely no risk to anybody in the United States, and they will be watched very closely for symptoms and moved into isolation should they exhibit any concerning symptoms. But no, I don't believe that they pose any health risk at all.
All right, Dr. Amy Edwards, thanks for joining us on the missionaries who are now back in the United States after some dangerous work. Jenna?
You're welcome.
Well, the news tightens on pro-Russian separatists in